Today I want to talk about the difference between a sleeve gastrectomy and a gastric bypass by using one of my favorites, Play-Doh. These are both amazing weight loss surgeries that are used to help our patients, but fundamentally they're quite different. So let's take a sleeve gastrectomy, which is probably the most common surgery done in America. In a sleeve gastrectomy, unlike a gastric bypass, we only make changes to the stomach. So if this is your intestinal tract, here's your esophagus, here's your stomach, food then goes down your small bowel. So in a sleeve gastrectomy, fundamentally, what do? We just make the stomach smaller. And we do this by surgically removing about 80% of the stomach. This part, called the greater curvature of the stomach, goes away. And what you're left with is a smaller stomach that's about 80% less in volume. This other part of the stomach here is permanently removed. And when that happens, we find that patients eat a small amount of food, they feel restriction. There's a hormonal change in this part of the stomach that happens because there's a hormone called ghrelin that's made in this part of the stomach that secretes a hormone that makes patients hungry. So when this part is gone, patients report a much better feeling of satiety or fullness when they eat. Now let's take a look at a gastric bypass. Gastric bypass is one of the oldest surgeries that we do for weight loss, and it's just a little bit more complicated than a sleeve gastrectomy. In the gastric bypass, we're also cutting the stomach, but we're actually making it very, very small. From the size of a banana of a sleeve gastrectomy, we're actually making the stomach about the size of a golf ball. So this part of the stomach is now completely separated. And when we do that, ultimately what happens is we bypass a large portion of intestines. So once we cut the stomach and we have a small gastric pouch here, well, we have to be able to digest food somehow. So what happens is we now go and we separate the intestinal tract here, and we bring up a loop of intestine so now patients can digest food. So the intestine's brought up, an anastomosis or connection is made between the small gastric pouch and the intestine. So now patients eat food here, and this part of the intestinal tract, which drains the liver and the bile, is reconnected down here. So let's look at this anatomy now. Now we have the esophagus. You have a small portion of stomach here. You have an intestinal tract, or your jejunum, that's hooked up here. The continuity is kept in place, but all this extra stomach that's left behind no longer sees food. All this part of intestine no longer sees food, and the digestional juices from the liver drain here, and once food goes down here, helps you digest food. So this whole part is bypassed. Food now goes down this way, and that's a fundamental difference between a gastric bypass and a sleeve gastrectomy. Also important to know, in a sleeve gastrectomy, you can always convert that to a gastric bypass. Once you do this is a very much more complex surgery. Both great surgeries, different reasons to do both. Fundamentally, that's what happens. All thanks to Play-Doh.